Hello, my name is Alok Sharan. I am the Deputy Editor for Digital Health Transformation at the journal Clinical Spine Surgery. I am very excited to introduce to you the next issue in our journal for the month of June. Today, I will be highlighting a very appropriate and timely article in spine surgery entitled Image Guidance, Robotics, and the Future of Spine Surgery. The use of navigation and robotics in spine surgery has advanced tremendously since its inception. I was recently honored to be part of a presenting panel to about 2,000 orthopedic and spine surgeons in India, where we had a robust discussion regarding the use of navigation and robotics in complex spine deformity. It's clear in looking at the cases that the use of navigating technology has helped improve the outcomes for this very challenging procedure. For this week's visual abstract, we chose to highlight a narrative review written by Ahern et al., published in Clinical Spine Surgery, on the use of navigation technology along with robotic technology. You see, generally, we know that spine surgery is very beneficial, but there are certainly some safety issues that still need to be addressed. The placement of pedicle screw instrumentation has completely transformed the field of spine surgery. Unfortunately, there is still a significant breach rate for the placement of pedicle screws, especially using the freehand technique. It is estimated that there is an approximate 8% breach rate with the placement of freehand pedicle screws. One study cited in this paper showed that the breach rate for pedicle screws is 2.7% with the use of navigation. Although not definitive at this point, there certainly is a trend towards less breach with navigation. The one question that has not been answered to date yet, though, is the correlation to outcomes. These studies still need to be conducted as it relates to the breach rate for both navigation as well as freehand pedicle screw placement. Now, radiation exposure is still an issue, and many surgeons still rely on X-ray and fluoroscopy for the placement of screws. There has been one study that showed that spine surgeons can be exposed to about 12 times greater amount of radiation than non-surgeons. Clearly, this is not a sustainable solution, and the hope is that both navigation and robotic technology will help decrease the reliance on X-ray for the placement of instrumentation. Robots, of course, have made tremendous advancements in the spine surgical field. Per the paper, robots can basically perform three separate functions. One is to be a telesurgical system where there is a remote command system and the surgeon controls every movement of the machine. Two is a shared control system where both the surgeon and the robot control motion. And three is a supervised control system where a robot can perform actions autonomously under close supervision of the surgeon. At this point in time, most of the robots in spine surgery are a shared control system. In the article, Ahern et al. Discussed the various robotic systems. Overall, the robots have been shown to be very effective with not only the placement of instrumentation, but also helping reduce surgeon fatigue, which is very important in this day and age of surgeon burnout. Unfortunately, the capital costs for purchasing a robot, along with maintenance costs, are significant, and these are issues that will need to be addressed, especially during this post-COVID period. Greater studies still need to be performed on the cost-effectiveness of robotic technology. While there is no question that robots and navigation are improving the field of spine surgery, there is still a lot of work that needs to be done. There is one company that has integrated augmented reality into surgical navigation so that surgeons can see the patient's real-time anatomy from a preoperative CT while they are performing surgery. This certainly will help improve the safety of spine surgery. I was recently asked during the panel discussion in India if there is a role for robotic surgery while the patient is awake. There have been a few case reports of surgeons across the world who have demonstrated the role of robots for awake spine surgery. If the patient is calm and comfortable, the use of a robot can certainly help expedite the case, adding to the efficiency of a lumbar fusion. We are clearly at a very exciting time now in spine surgery. The use of navigation and robotic technology will completely transform this field.